Let's take the example of a diabetic patient in the fee-for-service world versus the fee-for-value world. So in our traditional fee-for-service system, a patient with diabetes that's relatively well controlled and not bouncing in and out of the hospital is going to come see a provider 4 times a year. Each time they come in, they'll have a hemoglobin A1C checked to see how their blood sugar levels have been running over the course of the last 90 days or so. What often happens is that patient comes into the office, has the labs drawn while they're in the office. The results come back a day, 2 days, 3 days later. The physician now has to run through those results, identify the hemoglobin A1C level, and then have the nurse call perhaps to make a medication change. That may or may not happen. Patient comes back 3 months later, still not much change. In a fee-for-value world, what happens is those patients are often identified as they come in with a gap. So maybe they need an A1C drawn that hasn't been drawn, or they're identified before the visit as a patient whose last A1C was elevated and needs some attention. But even if in that visit that A1C is high, then there is the opportunity in a value-based world for a pharmacist to identify that elevated A1C, for instance, reach out to the provider and or the patient and intervene. So oftentimes what we know is patients with elevated A1Cs may not be able to afford their medicines. We talk about non-compliance, but patients have to make decisions between keeping the electricity on or buying their medications. A pharmacist or a care coordinator, either one, can reach out to that patient with that elevated A1C and determine some of those reasons or barriers that the patient may be encountering that are keeping them from getting their A1C under control. So we're much better able to support that patient between those every 3-4 month visits and to help drive outcomes in that period of time, so we're not just waiting for that next office visit to come around to address the A1C that was elevated 3 months prior.